How does the hospital address the issue of readmissions and focus on providing efficient and effective post-discharge care?
I would say we're actually doing very well on our readmissions. We always exceed our goal. And yet, again, as we said earlier, it's a fine balance of not making discharges seem so important that you're at risk of readmissions. I mean, we're going to always have some readmissions, but the good news is we are below the standard rate. So we're pleased about that. But we have actually an interesting, we call it our Vanderbilt Discharge and Transitions program. So we call it VDAT, VDAT, Vanderbilt Discharge and Transitions team. It really has 3 work streams, and it's about discharges, transition, and then of course post-acute care. And we start off by the first work stream is making sure that everything a patient needs for a discharge is there. And again, this center is staffed with nurses and social workers and pharmacists, et cetera, who are making sure that we've got medications to go home with and that we're doing that medication reconciliation. That can be very confusing for a patient who came in with home meds, had a bunch of medications and pharmaceuticals while they were here, and now what do they go home with and what do they take? So really making sure we're looking at those high-risk medications and educating the patient is important, making sure they have all the discharge paperwork and that it's complete and they know who to call. So that whole body of work, I think, was our initial work stream. And then our second one is really that transition, making sure that we call the patient after discharge to make sure that they are doing well, that they've got the follow-up appointments that they need. Because sometimes, if you don't go home with an appointment time, we want to make sure you're called with an appointment. And then if you need to have a telehealth visit, you can have one, or if you need an e-consult order, that you have access to that. And then the last one is just making sure that any to post-acute is well cared for. We can do telehealth at the post-acute care centers. We've got good partnership with post-acute, and we've got complex care coordinators that are watching those patients to make sure they've got everything they need. And so this has been, it was stood up during COVID, not because of COVID, it was already in the plans. But I think we've been able to decrease our readmissions by about 5%, from the beginning to where we're at right now. So it's been a great success. It's been a big investment, but I think our patient experience, which is an important metric, has also, for those that are in this program, has really improved, statistically significant. So I think how we wrap up the discharges is really important.
And I would also question, are you seeing better patient outcomes? Because now you're following up with these patients and they're getting to where they need to be. They're doing what they need to do. So,
yeah, great question. I would hope so, because there's less readmissions. Tying the two together is a little bit harder, but I think it's been a good success.